Hello, I'm Dr. Charlotte Middleton and welcome to today's video on brown spots. Fascinating, I hear you say. Look, stay with me because it's a video that could be pretty important to your health and one that might just motivate you to go see your doctor. It was born out of a question from one of our followers on the development of some brown spots on her face that she wasn't sure what they were, and she made particular mention that she hadn't had a lot of sun exposure. So we'll talk about that particularly in a moment. But what are brown spots? Well, obviously there can be an enormous variation on what that means, but generally I guess when we talk about the appearance of brown spots on the skin, we're talking about the appearance of flat oval areas or blemishes that appear on the skin, and they can range in colour from light brown to dark brown to red or even black. Now they typically appear after exposure or prolonged exposure to the sun, and they often start in middle age, and the most common areas that they appear will be the face, the hands, the shoulders, the arms, the forehead, and even the scalp if you happen to be bald. Now, usually they don't require any treatment and are no cause for alarm, and only will usually require treatment if there's cosmetic reasons for that. So, as I've already alluded, one of the causes can be UV light or exposure to the sun, and that often results in things like your freckles or your age spots or something called melasma, which is a typical sort of facial pigmentation. Also, you can get brown spots after trauma caused by skin diseases, so such things as acne or post-inflammatory pigmentation and other different diseases, most of which have got very long words and I won't go into today. Certain medications we know can cause brown spots, and then there are other situations or disease states that also we know can predispose you to the development of brown spots, and that includes pregnancy, liver disease, Addison's disease, hemochromatosis, or certain pituitary tumours. And don't forget that there are other types of brown spots as well, such as seborrheic keratoses, moles, melanomas, which are obviously very important to know about, and even cafe au lait spots. And what we know is that particularly in the instance of freckles or age spots, that you can be predisposed to the development of those if you've got light coloured skin or fair haired, if you've got a history of frequent sun exposure. Now, the development arises because we have in the upper layers of our skin a pigment known as melanin. Now, if for whatever reason, whether it be from sun exposure or some sort of trauma, the melanin can be triggered and can accelerate in production. And over time, that can result in these brown spots developing over the skin areas that I've already spoken about. Now, aside from sun exposure and the other causes that I've already mentioned of developing brown spots, it really can just be a simple aging process, or something that you have in your genetic makeup that makes you predisposed to developing brown spots along the way. Now, looking in terms of treatment of brown spots, the most obvious thing that you can do is to protect your skin from the sun and to be sun smart. So that includes sunscreen and hats and wearing long sleeve tops. There are out in the market a lot of anti-aging creams or fading creams that often contain a component called hydroquinone or antioxidants such as alpha hydroxy acids, vitamin C, or retinoids. You also can go to beauty salons or your dermatologist for such things as chemical peels, cryotherapy, and there are multiple different laser treatments out there as well. Now, if you're looking for something a little bit more natural or something that's no doubt a little bit cheaper, there are all sorts of things that you can look at on the web that are touted as helping with brown spots. These include yogurt treatments, aloe vera, onion juice, sandalwood paste, castor oils, that is topically, not ingesting it, buttermilk, lemon juice, horseradish juice, sour cream and honey, strawberry and apricot packs, yellow mustard packs, papaya juice, pineapple juice, and parsley and turmeric. I don't know about you, but give me the fruit ones over the onion juice any day. But as I said, all there on the web for you to have a look at and see if any of them might be right for you. Look, at the end of the day, my advice is that you can never be too sure. Any new spots that develop, whether you think they look benign or not, you should go to your doctor and have them checked over. And particularly if any of those brown spots have any sort of dark pigmentation, have an irregular border, there's been a rapid increase in size, if they're tender to touch, if they're itchy, if they're bleeding, and if they've got a redness around them, all of those features are a cause for alarm, and you should go and see your doctor ASAP to get that lesion reviewed. Thanks so much for watching today, and I look forward to seeing you soon. Bye for now.